It is important to prioritize your health and future well-being. Premarital medical tests are not just for formality, but they are responsible steps towards building a healthy and informed relationship. Premarital medical tests are very important and should be done for you to be able to know if you and your partner are compatible, to be able to give birth to healthy children in the future, to detect and address health issues early, to ensure each partners are aware of each other's health issues, to avoid broken heart and broken marriages, and to plan for a safe and healthy future together. Today I'll be telling you those medical tests you need to do before you say I do to your partner. Hello viewers, welcome back to my channel, Ask Your Nurse. If this is the first time of seeing my video, I'm Ashamoluwashon. I'm a registered nurse. Thanks for stopping by. This channel focuses on content related to health. Do well to subscribe to my channel, like, and hit the notification bell below to be the first person to know the next time I upload another new video. And to my returning subscribers, thank you guys for all you do. One of the most important premarital medical tests you need to do is genotype screening for compatibility, to avoid AS marrying AS or AS marrying SS and giving birth to children with sickle cell disease. Genotype is the genetic code in your blood, that is the type of hemoglobin you have, and this is inherited from both parents. It is important to know your genotype before marriage to avoid giving birth to children with sickle cell disease. There are 4 main types of genotype: AA, AS, SS, and AC. There are other types, but they are less common. That is the SC and CC. If you have AA genotype, it means you have normal hemoglobin and you are safe to marry any genotype. If you have AS genotype, it means you are a carrier, although you do not have sickle cell disease, but you can pass the gene to your children. And that is why you should avoid marrying AS, SS, or SC to prevent you from giving birth to children with sickle cell disease in the future. If you have SS genotype, it means you have sickle cell disease, which causes serious pain, anemia, and other complications. If you are SS genotype, you should avoid marrying AS, SS, or SC. The best partner for you to marry is genotype AA. If you have genotype AC, it's just like AS. You are generally healthy and you do not have sickle cell disease, but you can pass this gene to your children. So you should also avoid marrying SS, AS, AC, or SS. The best partner for you to marry is AA. Genotype SC is a milder form of sickle cell disease, while genotype CC is very rare but can also cause mild to moderate anemia. So if you have not done your genotype, please go and do it now, and ensure you do it in 2 or more standard places to compare and be sure of your actual genotype. Because I've seen many people saying before they were AA but later discovered that they are actually AS, which is very dangerous and misleading. This may be due to expired reagent, non-potent reagent from poor storage, because of this poor power supply, and many factors. That is why I usually advise people to do their genotype in 2 or more standard places. Another important premarital medical test you need to do is blood group and the rhesus factor. This is done to know your blood group and to know if you are rhesus negative or rhesus positive. Because if you are a female with a rhesus negative blood married to a rhesus positive blood, and your child now takes after the father, which is rhesus positive, after delivery of the baby, you need to take an injection called Rogan to prevent recurrent abortion and stillbirth in the future. People with rhesus positive blood are just 85% worldwide, while people with negative rhesus factor are just 15%. So the possibility of you marrying a rhesus positive blood is very high. Let me quickly explain why you need to take the injection after delivery or after the end of each pregnancy of a rhesus positive fetus, either you carry the pregnancy to term or not. Rhesus positive means you have certain protein on the surface of your red blood cells, while rhesus negative means you don't have this protein on the surface of your red blood cells. So if you are a rhesus negative woman and you are married to a rhesus positive husband, and your child now takes after the father's rhesus factor, which is rhesus positive, your whole blood, we see the baby's blood as a foreign body, as a threat, now begins to produce antibodies, which are body soldiers to fight the baby by destroying the blood cells of the baby. But by the time the body will finish producing these antibodies, the baby will be born. So the RhoGAM injection will now be given to kill those antibodies already produced in your blood, to make the environment safe for the future pregnancy. But if you don't take the injection, those antibodies, those body soldiers will be at attention waiting for that type of foreign body again, which is the rhesus positive fetus. So if you now get pregnant again with a rhesus positive fetus, the already produced antibodies now begin to destroy the blood cells of the baby, leading to abortion or stillbirth. But if you are pregnant with a rhesus negative fetus and you now give birth, there's no need for you to take RhoGAM, because your blood sees the baby's blood as friends. So as friends, there's no threat, there's no fight, no antibodies is produced, so no RhoGAM is needed to kill any antibodies. That is why you need to know your blood group and the rhesus factors before you get married, to prevent recurrent abortions and stillbirths. Another important premarital medical test is screening for infectious diseases like HIV, like hepatitis, like syphilis. This is done to prevent you from infecting your unborn children, as there is a special care you'll be given to prevent you from transferring the infection to your unborn children. Also, fertility test is done for both men and women. For men, semen analysis is done to correct low sperm count and prevent future infertility. For women, hormonal profile is done, especially for women with irregular menses or PCOS, which is polycystic ovarian syndrome, to be able to get early treatment and prevent infertility in marriage. Genetic test or inherited disorder screening is also done, for example for thalassemia, cystic fibrosis, for you to be able to plan for healthy offspring. General health checkup is also done, like blood pressure to know if you are hypertensive or not, blood sugar to know if you are diabetic or not, cholesterol level to detect if there is any abnormality, and receive early treatment to prevent complication in the future. You can consult your physician for any special test you feel you might need. We've come to the end of today's video. Thanks for watching to the end. I hope you've gained something. If you have, you can also help me by liking this video, subscribe to my channel, share with your friend, and turn on the notification bell below to be the first person to know the next time I upload another educative content like this. See you in my next video.